Today I'm visiting with Dr. Shawn St. Peter, who is our Senior Vice President and Surgeon-in-Chief, as well as our Chair for the Department of Surgery. And today we're going to talk about how Children's Mercy has become a national leader in pediatric surgery. And a large part of that is because of Dr. Shawn St. Peter's leadership. So Shawn, thank you so much for joining today. I know you're very busy. We appreciate you taking time to talk all about the great accomplishments that we've had in our Department of Surgery and related subspecialties. So, we often talk here at Children's Mercy about how our people are our greatest asset. So tell us about how the people that you work with, your peers, your partners, your collaborators in surgery, have helped us accomplish so many things within the Department of Surgery and our specialties.
It's timely that you asked that, because I've always felt that we had a really strong department that was made of people who cared about each other as well as about the patient base that they were trying to take care of. That allowed us to get through those times when it's really busy and we don't have any control over it, but we've got to get those urgent patients taken care of who have surgical needs. Now, coming out of the pandemic and facing some staffing crises, we've had to figure out how we're going to get the same amount of urgent work done with fewer people and fewer rooms. And we have successfully been able to do that, but we've done it on the back of people who are just willing to work harder and willing to do more for the sake of what we're here for.
Yeah, I think what you're pointing out, Shawn, is the agility and the resilience that we've experienced going through the pandemic, and yet coming out of it and still being able to accomplish so much is due to exactly what you described. Great people who are willing to do whatever it takes to provide great care to children. So thank you for that. What are the team accomplishments that you believe have made the most significant impact on our surgical capabilities and our programs?
We've had several. I guess I would look at an underlying theme, and it started initially with developing prospective randomized trials, but within that you have to develop protocols. Once you develop protocols, you reduce the variation in care that you typically see across a multitude of conditions. Then as a result, now you not only are able to figure out which of these two methods that you're testing is the iteration to go with next, but you've got data that was based on a protocol that now is an iteration that you can test against the next. And with that, you can continue to move forward and make progressive advancements. All the while, you improve the communication between the ED, nursing, the floor, the surgical team, because people know what to expect when we have these protocols in place. And that has started to permutate into QI and PI projects across the department. It started in general surgery, but it's moved elsewhere. And so people are beginning to see the value of evidence-based medicine driving protocols and taking a step back from when it's time to employ the art of medicine.
I know one of the things that I was aware of before I came to Children's Mercy was that we were one of the first children's hospitals to achieve the surgical verification recognition. Talk to us a little bit about that, because you were certainly part of that journey some years ago.
Yeah, the concept was that we have verification levels for trauma. We had them for burn, but not for pediatric surgery, which means there are adult facilities that can provide pediatric care that can advertise themselves as pediatric surgical centers. And Keith Oldham and a group of leaders within the American College of Surgeons started to recognize there is a very distinct difference between being able to provide comprehensive pediatric care in every subspecialty or being able to take care of a child for a certain subset of conditions. The problem is the public doesn't necessarily see that they see pediatric ER at a given hospital and they think that that's a facility that can take care of children. So once we lined up all of our ducks and started to pursue verification, we were the 9th center in the country. And so we were of the first group that got verified.
That's great. Shawn, what you remind me of is, our vision is a world of well-being for all children. And you talk about creating impact, not only here at Children's Mercy, but impact that can be felt across centers all over the country and really beyond. So I'm very proud of your leadership and the team that has brought that recognition to fruition. Another thing that just blew me away when I came to Children's Mercy was the rich history of pediatric surgery that we have here. Talk to us a little bit about the history of pediatric surgery here at Children's Mercy and some of the people who have been instrumental in bringing it to life.
The initial textbook in pediatric surgery is The Surgery of Infants and Children by Bob Gross. Almost every pediatric surgeon has a copy of that, or they've tried to get one. It's still a great memento in our field. He didn't have another edition, and he wasn't interested in putting out another edition. So it went a long time before Saunders reached out to a few people. One was C. Everett Koop, former Surgeon General, who reached out to Tom Holder, who was here at Children's Mercy. Then a couple of years went by, and Saunders circled back to Tom Holder, and he said, "Okay, I'll do it. I've got a junior partner, Keith Ashcraft, who is a very good writer," and they put together the next edition of that book. But Bob Gross said, "You got to change the title," so it was just Pediatric Surgery, and that was by Ashcraft and Holder. Those are two of my predecessors here, and we just finished the 7th edition in 2019, and I was an editor on that, and we're actually making an 8th now.
That is just I feel like I just listened to a history book on tape, so, thank you for that. I often reflect on how important it is to appreciate and celebrate our history, but also use that great history to propel us forward as an organization. We've made such an incredible investment in pediatric research here at Children's Mercy. We're sitting inside the Children's Mercy Research Institute. So talk about our advancements and how research is helping to propel us forward.
Research is a bit of a passion of ours, particularly within clinical care and clinical outcomes. And while there's always going to be those pockets of more rare conditions that have higher impact, like congenital diaphragmatic hernia or necrotizing enterocolitis, we'll help facilitate that work. But fortunately, over the last 10 years or so, there's been several groups that have come together realizing that pediatric care is frequently a large pool of infrequent diagnoses. So in order to do meaningful research, we need meaningful numbers. And so the Midwest Pediatric Surgery Consortium was founded in 2013. We were a founding member of that group. And it currently has 16 active projects, of we're the primary investigators on 3. We've published 35 manuscripts, and that consortium is continuing to grow. So what I'm seeing happen is twofold. One, we're going to see more robust data answer questions with more precision and more confidence. But where we're starting to transition is we spent these past 10, 15 years doing these trials in order to improve outcomes. And these are hard measurable outcomes. Length of stay, did they get an NG tube, did they get a Foley catheter, what was their hospital charges? But what we don't have is the subjective experience. And so we're starting to roll over to that side of it. A good example is pectus excavatum. We got the bars in, they were doing well. We started to control their pain, they were doing better. But how are they during the 3 years that they have the bar in? What kind of symptoms do they have? And so we're now rolling out a monthly survey for the 36 months they have their bar in, and we want to know exactly what their subjective experience is. And we're going to be doing this for a lot of other conditions so that we can start to tweak what the patient experiences beyond what we see.
That's fantastic. Shawn, what you bring out is, I think, just characteristic of our culture of continuous improvement here at Children's Mercy. Through the Children's Mercy Lean system, we're constantly looking to improve the quality of care we provide, the outcomes, the safety, the patient-family experience. And I think the Department of Surgery and our surgical functions have been just the epitome of where quality improvement and continuous improvement takes place every single day. Thank you so much for joining me this morning. I'm so grateful for your leadership and the great work of the entire team of caregivers and all of our great employees that help you and help us to be the very best that we can be to improve the quality of life for children and families throughout Kansas City, throughout the country, and literally throughout the world. Thank you again, and thanks to you for joining us today. Have a wonderful day.